Hey, y'all. Hey, and welcome to another episode of Neuroinsights with Dr. Naeema. I'm Dr. Naeema, and today we're going to discuss something that's often on the minds of parents: how to support a child with autism in practical, everyday ways. We're going to tackle some common questions parents ask about everything from routines and behavior management to communication and emotional support. These are all essential tools to help both you and your child navigate life together. Let's dive right in. So, let's begin with something that can make a world of difference: establishing a daily routine. I know, daunting as it may sound. If you can get this done, I'm telling you, a consistent routine can help your child feel secure and give them the structure they need to navigate the day. But how do we set this up in a way that works? Please know that every child and every family structure is different. A consistent routine is key, but it's important to make sure it's predictable without being overly rigid. You can start by breaking the day into segments like morning, afternoon, and evening, and establishing specific activities for each part of the day. Visual schedules are incredibly helpful. These can be pictures, words, or even apps that show what comes next. This way, your child can always see what they'll be doing and what's coming next, which helps reduce anxiety about the unknown. Over time, routines become comforting for your child, not just for your child, for people with autism as well. But don't worry about every minute being perfectly scheduled. Flexibility is important. Grace is important. Now, I know transitions, moving from one activity to another, can often lead to meltdowns or frustration. Parents ask me all the time, how can we make transitions smoother? Transitions are tough for many children with autism, for people with autism, because they often don't know what's coming next, and it creates anxiety. The key here is preparation. Give your child a heads up before transitioning. For example, say in 5 minutes, we're going to stop playing and get ready for dinner. Or in 5 minutes, you're going to go and take your shower. Or you can use a timer to give them a visual cue. For some children or individuals, a warning of 2 or 3 minutes helps them mentally prepare for the change. You can also use visual aids or songs that signal the transition. For me and my household, even though I don't have a child with autism, I use music also to structure my day. So you know that in the morning I'm playing gospel and pouring into myself. In the afternoon, I might be playing some country loud love music, crunk music. We know that it's time to just unwind and just prepare for relaxation. You can choose a favorite song that plays when it's time to clean up. It's up to you. This signals a clear and predictable shift in activity. Another big challenge for many families is sensory sensitivities. Whether it's dressing, eating, or going out, how do we manage sensory challenges in these everyday tasks? How is it possible? Especially if you live in a city and there are lots of loud noises that are unpredictable. Sensory sensitivities are very common, and they can make simple activities feel overwhelming for your child. For dressing, try using soft clothing and allow them to have some control over what they wear. Giving them choices between two shirts, for instance, can help them feel empowered while reducing the discomfort of unexpected textures. When it comes to eating, you can try offering different textures or even foods that are not as triggering to your child's sensory system. When you're out in busy places, always have sensory friendly tools on hand. Things like noise canceling headphones, your own snacks, sunglasses, or a favorite fidget toy. These can help your child stay calm in overwhelming environments. Also, talking to them about what to expect and how do we make progress in what to expect. When we're going into a place that might be crowded, what do we usually feel, and how can we really manage in these settings? Let's move on to communication. As I was just discussing about sensory, it's also good to communicate with your child. Many parents of nonverbal children often wonder, how can I improve communication with my child, especially when they're not speaking yet? When your child is nonverbal, communication can still be effective. You still want to be talking to your child. You want to give them a way to communicate with you, though it may take different forms. A picture exchange communication system, PECs, are one example and an excellent way to help. In PECs, your child can use pictures or symbols to communicate their needs. You can also try using sign language or apps that help facilitate communication through symbols or voice output. Proloquo is one good app that is on the iPad that you can set for pictures, you can set for words, you can even set for sentences, and you list it in categories. And it has been proven to be help people to communicate very fluidly. Be patient and model communication frequently. If your child points to an item, you can say the word out loud for them, helping them link words to actions. Always make sure to celebrate small successes, whether they're using a symbol or making eye contact. It's very important and empowering. Another common question is, how do I help my child develop social skills, especially when they're struggling in conversation? So, one of the biggest things with a person with autism is the mirror imaging, and that's in the prefrontal cortex here up in the front. And what mirror imaging is in the brain is it helps you to understand other people are just like you, and they have needs and they have desires, and they have feelings as well. However, this is disrupted in a child with autism, and they don't have the capacity to really understand that there should be an ebb and flow in conversation. That's why when you have a conversation with a person with autism, the conversation can be very laborious. It's like pulling teeth almost. But we have to get them to understand that another person has interest, and you need to ask for their interest in how they're doing as well. Social skills development can be tricky, but with practice, children can learn to navigate these interactions. One way is to model appropriate conversations and role play with your child. You can take turns practicing greetings, asking questions, or even taking turns in conversation. Social stories are also great for explaining how to approach different situations, um, whether that's how to join a group game or how to ask for help. You can go online and look for different social stories as it pertains to their age and development and what their peers are doing, and go through it with them. And don't forget to celebrate even small wins. Your child saying hello to a peer or waiting their turn in conversation, those are small wins. It's all about building confidence in these skills over time. Now, let's talk about behavior management, behavior modification. Many parents struggle with challenging behaviors such as aggression, self injury, or meltdowns. How can we manage these behaviors effectively? First of all, it's important to understand that challenging behaviors are often arisen from communication needs. Behavior is communication. Behavior is communication. What is your child communicating? Your child may be feeling overwhelmed or frustrated and doesn't know how to express that. A good starting point is to try to identify the triggers, whether there's sensory overload, a need for attention, or an inability to communicate. From there, you can teach alternative ways for your child to express themselves in an adaptive, a functional, appropriate way, like using words or pictures. In the moment of a meltdown, it's important to stay calm and offer comfort. If possible, guide your child to a quiet place where they can calm down and reset. I like to tell parents that they can use a particular chair for them to calm down, or just a section away from other people where they can get themselves together, where they're not getting attention for the meltdown, because we don't want the attention feeding the meltdown so that it will be more likely to happen in the future, right? Positive reinforcement plays a huge role in behavior management. You can reinforce desired behaviors by praising your child when they do something positive, like using a calm voice or following directions. Positive reinforcement doesn't always have to be rewards. It can be as simple as verbal praise, like saying, "Great job staying calm. I'm super proud of you. You made a good choice." It encourages your child to repeat those positive behaviors, those behaviors that are more functionally appropriate. Next, let's discuss social interactions. Many parents wonder how they can help their child navigate playdates or group activities with neurotypical peers. Navigating social situations can be difficult, but it's important to remember that practice makes progress. Before a play date, you can explain the expected behaviors, things like taking turns, sharing toys, or asking to join in the game. Role playing with your child can help them practice how to approach peers and what to say. And role playing doesn't only have to be with children on the autism spectrum, it can be with any child who is facing something that is unknown and different for them. Also consider inviting a peer over for a structured activity that your child enjoys so they're more comfortable and engaged. Social stories can help prepare your child for what will happen during play dates. And these stories can also model how to handle situations like conflict resolution or taking turns. Let's talk about school and learning. A lot of parents ask how they can work with teachers to create an effective individualized education plan, IEP, for their child. An IEP is a collaborative process between you, the teachers, and the school staff. It's essential that you communicate your child's strengths and challenges so that the IEP is tailored to their needs. Be involved in every step, ask questions, and make sure the goals set in the IEP are clear and measurable. If necessary, request regular updates so you can track progress and adjust strategies if something isn't working. One thing I also like to let parents know is tell them when you're at that meeting that you need parent management training, that you need training to better understand how to work with your child based on what the findings were in the school. And the school will provide you with that. The more information you can provide about your child's needs, the better the support they'll receive. Finally, let's touch on something that is often overlooked: parent self care. As a parent, we think that we have to be the end all be all for our child. If you are needing more support with your child, know that there are behavioral health supports like a therapist, a neuropsychologist that can help guide you within your home, within your emotions, within parent management training outside of the school, um, and really how to manage your emotions geared around your child. Caring for a child with autism can be very demanding, and it's crucial to find ways to manage your own stress. It's easy to forget about yourself when you're focused on your child's needs, but you can't pour from an empty cup. Take time for yourself, whether it's a hobby, exercise, or simply taking a break. Finding a network is also vital. This could be friends, family, or even a support group where you can connect with other parents who have where you can connect with other parents who understand what you're going through. And if you ever feel overwhelmed, don't hesitate to seek professional help, whether it's a counselor, therapist, or support coach who can help you navigate the emotional challenges of caregiving. And remember, you're not alone. You're not alone in this. Every parent's journey is unique, and there are resources and communities and there are resources and communities that can help support you. Thank you for joining me today on Neuro Insights with Dr. Naeema. I hope these tips provide you with the tools to better support your child and take care of yourself along the way. If you found this helpful, please like, share, and subscribe. We're on YouTube at Dr. Naeema Giving Hope, on Instagram and Facebook at Dr. underscore Naeema underscore at Giving Hope LLC, and at underscore I feel in color underscore. Make sure you go to your Google or Apple Play Store and download and use our app today, I Feel in Color. Sign up and start using it. It's free. Take care, and I'll see you next time. Be blessed and continue to be a blessing.